Dental implants are, I think, the gold standard for replacing a single missing tooth. I think for a long time in dentistry, dental bridges were viewed as like the number one way to replace teeth. The issue with that is if you have a single missing tooth and you tie those two adjacent teeth to it, you're tying now like a whole quadrant of someone's mouth to that bridge. So God forbid something fails. Now we're not talking about the replacement of one tooth, we're talking about the replacement of 3 teeth, which you're now leaving that whole side kind of useless until the full treatment is done or until you're able to fix the problem. With the dental implant, it mimics what a dental root looks like the best. So the implant's what actually goes into the bone, and then what you see kind of above the bone and above the tissue is the crown that goes on the implant. For single missing teeth, that's what I view as the best replacement for them. But if you have several missing teeth, you can also use implants to anchor a bridge. And so now you can do an implant bridge. If you have a full arch missing, you can do implants that are used to restore a denture or are used to restore a kind of a long span zirconia bridge, which we call an all-on-X. So there's all these different subtypes that you can use an implant for. But I would say the most common thing that we see is someone coming in with a broken tooth that needs to come out. And implants can be used in a way where the same time the tooth comes out, the implant can actually go in. And now you're looking at getting a full tooth to replace that area in 3 months. So now you're dealing with something that's, it mimics what was there before the best. And it's only taking 3 months in terms of healing and allowing that implant to integrate into bone before you have something there that essentially puts you back to normal strength or full strength again. I've seen dental implants change people's life both for single teeth and for more complicated cases. I had a patient about a year ago who unfortunately had to have all their teeth removed, and he had it done not in the practice that I was working in, but in a different practice. Then he came to us because he wasn't satisfied with his dentures, and he had just gotten kind of fed up with the steps that he was going through to get improvements with his removable denture at the time. After a consultation with me, he met with our periodontist, and we ended up placing 6 implants, and then we ended up creating an all-on-X zirconia bridge that sat on all of those 6 implants. After having that restoration for a month, I actually had a follow-up with him, and he told me that he was able to taste food again and that his day-to-day had just improved. So he actually had lost a significant amount of weight in the removable denture because he just couldn't eat. And he had lost, when you lose your taste and food, it just becomes something that you just don't find to be a pleasant experience anymore. After a month follow-up to make sure things felt good, the bite felt right and everything like that, he had reported that not only had he regained all those kind of senses, but he was also, somebody who I had met initially, and he didn't even flash a smile at me. And I had seen him for about 10 appointments to get this done. He was, with the hygienist, he was smiling and they were giggling when I walked. So I've seen an all-on-X case change people's lives, not only in terms of aesthetics, because most people who come in for all-on-X treatment don't have, they don't have the most aesthetic appearance of their front teeth because a lot of them are broken down. But also functionally, I've seen patients just become a lot healthier after because they're able to eat comfortably again. And usually it's the first time they're able to eat comfortably for many, many years.